So I'm on call every day. There is no holidays or days off.
Our guest today is a director at a group for adults with autism, and she has owned and operated her own home health facility, that's what I gather, in the past, and has written over 20 books, written and published 20 books. So Carrie Williams, it is an honor to be speaking with you today. I'm really excited about this interview, and I'm really excited about hearing your story and your endeavors through healthcare and your journey, how you got started and everything like that. So to get started, would you please go ahead and just introduce yourself and give us some sort of like little bit of a background on your current position as a director, what you do exactly, what that entails in your job, and then we can go from there.
Yeah, so I'm Carrie Lee Williams. I am the director for Jefferson County Hub of Judavine Center for Autism. What that means is I help manage 8 ISLs in the community, which is 24-hour care for consumers with autism. I also help manage a day program that runs Monday through Friday, where adult consumers can come and receive services. We also offer supportive employment and pre-employment services to get consumers ready to work. We also have an ABA therapist and a BCBA therapist that help with things within the hub. They kind of run separately. And as a hub director, I'm responsible for hiring people, getting placement, making sure everything runs smoothly, that all the documentation is done correctly, finances is done correctly. And then I'm responsible if there's a crisis that happens, I'm the one that if that manager that's over like the house can't fill in, then I'm called in to fill in. So our consumers have to have someone with them, usually 24/7, 7 days a week. So I'm on call every day. There is no holidays or days off.
Mm-hmm. And by consumers, you mean the patients that you guys care for?
Yes, the patients that we care for. Usually, typically, they have at least an autism diagnosis. Some of them have multiple diagnoses, and a few have physical disabilities as well.
Oh, that's very interesting. Well, how did you get started in this? Actually, can you tell us the story of your beginnings? And then sort of work your way up and just let us know how you became the director, because it seems like you have a lot on your plate right now in terms of what you're responsible for and where you have to step in.
So how I kind of got started was I was a stay-at-home mom and a self-published author, and I decided that I wanted to get back to work, and I started doing my own in-home healthcare. And then I started doing nannying services for people that had children with special needs. And that kind of created its own business of basically a home manager, where I was going in and just helping manage families. Like whether it was like they needed meal prep, they needed nanny care, they needed someone to run errands or shopping, or they needed someone to stay with their elderly parent for a while. So I would kind of, at the peak of that, I had 9 clients that I saw on a daily, weekly, and monthly basis. And I decided to go back to school. I went to Maryville University, originally for a nurse. I was 1 year away from my nursing degree when my husband went into kidney failure, and they said he was going to have to get a transplant. I couldn't finish my nursing degree, so I switched to healthcare management because I could do that from online. Really quickly, he got his transplant. He's doing great. I finished my degree, and then I was ready. I told all my consumers, like my clients, I'm like, hey, now that I have my degree, I want to like get into working for a healthcare practice. And so I started letting my clients slowly go and retraining my replacement for each of the clients. for them. I started putting out my resume everywhere, going on all these interviews, and they were like, your business, even though it was healthcare, doesn't matter because you didn't manage employees. They were like, didn't want to give me a chance. I kept getting turned down and turned down. It took me a whole year. And I finally interviewed with Judavine Center for Autism for what was considered their home management position, which was to manage a house that had 2 consumers in it for 24-hour care, where I would start creating schedules and being their kind of the day-to-day person, make sure that the consumers got their doctor's appointments and all their paperwork and MARs were done correctly. So I was on the right track. And I was very disappointed when I took the job originally because college told me I would be making 60 grand a year. So after a year of looking, and they offered me 36 to be the house manager, being on call 24/7, 7 days a week, I went ahead and accepted because I was like, I need something to get in, and I did it. And I took the house, had a very low quality control score, turned it around within the year that I was running it from the low 70s all the way up to 98% quality control score. And it just so happened that right at COVID, I was bored. So I decided to go back to school and start working on my MBA through West Coast University. And I was doing that, and I went ahead and decided through one of my LinkedIn contacts, let's go ahead and spruce up my resume now. And I did that and got the nice polished resume back that I paid for when the director position came open for Judavine. And they called and asked me to apply for it. And so I went ahead and sent off my new resume to them. I did the 2 interviews that I had to do with the company. And they typically want you to already have your MBA for the director's position. But since I graduate in August, I'm almost done. They went ahead and, because they're promoting me from within the company, they went ahead and promoted me up to the director. And they're kind of hoping that what I did for that house, I'll do for the whole hub. So that's kind of my story in a nutshell.
Right. So would you say that it's when it's time to move up as a director or anything like that, does it really pay to know people or to already be in an organization?
It does help to build those relationships. So one of the reasons why I was asked to apply compared to other people that had been there longer was I was the one that would go in and talk to the current director at St. Louis County. I would talk about ideas of ways we can improve the organization beyond the scope of what my job was. And I would always kind of run these ideas by her. And I made sure to let them know I was back in school. And they knew the clock was ticking to, get me promoted. And I actually went in before this position came open. And I'm like, listen, we need to find a way to get me promoted. I'm like, I knew there wasn't a director's position open. So I was actually talking with the director about trying to create a new position. I was like, we need a manager above the house managers to help out with like additional training and this and that, so I can go in and train the new house managers. And she was actually considering it. But then when the hub position came open, they were like, this will pay more. So I applied for it.
So that's amazing. Okay, so what you did, you did an amazing job, as their manager with your $36,000.
Yep.
But so you got them from one level to another level. They were able to see what you can do.
Yeah.
Okay, and then within a year?
1 year, I was promoted from house manager to hub director, which most people don't really kind of know what that means, but it would be similar from going to like, say the manager to a district manager.
Right.
So instead of a manager of just the one, now you're the manager of several. So that's kind of what the hub means.
Okay. So, what was your mindset throughout this whole process or throughout the year? Were you thinking, like when you started this job, that were you thinking things like, what do I have to do in this position so that I'm not here next year? Or were you kind of just going with the flow? Or were you just, do you feel like you just had the passion for the job, or what was it?
Well, I had the passion for the job, but I also knew that I'm the only one working for my family. Even though my husband's surgery went really well, he's still considered disabled. And I have two teenagers to support. So when I went to the director and asked to be promoted, my I guess outlook was they'll either promote me or I'm going to start looking elsewhere. Even though I love what I'm doing, I just won't be able to afford to stay at 36,000,
Right.
especially when getting my MBA shortly. So
Mhm.
I started prepping
We
for
have to put
either.
that in our heads.
So, I mean,
Get
I
ready.
started looking at MBA internships possibly, and I applied for a couple of those. They didn't pan out. I didn't get calls for them, but at the same time, I always try to look at it as life leads you where you need to be. And when the director position came open, even though it's still not even where I thought I would be paid, I was like, this is a new opportunity. This is
Mhm.
going to build my resume even more. It's going to give me a chance to actually have some of those ideas I want to try to actually get them implemented. Where I was talking to the director, like, what if we did this? What if we did that? I'm like, this would give me more opportunity. And eventually, my goal is maybe I'll get more fundraising into the organization, and eventually they can all give us all pay raises.
Yeah, either that or maybe they'll be able to see what you can implement or what you can do, and then you'll move further that way. Or who knows? I mean, as long as you're doing great things for this company and you do have proof of that, I think that can also take you somewhere else that's a whole lot better, a much better situation, and maybe you will get that pay that you really want, that you were promised when you started.
Yeah,
Um,
when I get started,
you know,
I'll finally reach that level of pay for my bachelor's degree when I get
right.
ready to have my MBA now.
Exactly,
But I
exactly.
can say, despite pay and everything, one of the benefits is this it does consider as a public service job. So if I stay with the company long enough, my student loans could be forgiven. It's a great opportunity for people to
Right.
think about when you have like 80 grand in student loans, like I do, that
Yeah,
even though
over
I'm getting less pay, right now, my student loans are $0 a month because they consider a family of four. I don't make enough still. And each month that still counts as a payment. So in 10 years, they can forgive my student loans.
hopefully, right? That would
Right.
be amazing.
So,
Yeah,
I
that's
mean,
cool.
that's a benefit. And then really when you start to make a change, like, and you see the change in a consumer, if you're that driven to healthcare and the passion for healthcare, you're going to start to realize the difference you make. And that's going to be a different type of payment. And it's going to give you a different type of feeling so that you're like
Mhm.
excited about your work and you're excited about what you're doing. And that's what gets you through those when everything is going wrong and falling apart.
I
That keeps
agree.
you motivated because you can remember. But remember when that consumer who doesn't show emotions gave you that hug? That is, that's that
Yeah,
thing that you got to look at. Or you have that one consumer that's mean to everyone else, but they were nice to you. And that can go with patients. So, like, even like when I was doing like nursing internship type stuff and we had to do the patient bedside, you have that grumpy patient that was mean to everyone else, but then they were nice to you. That feeling that gets like, I don't know, it just helps
but you
keep you
did
going
something
during
big.
the rough times.
Uh-huh. Yeah. Yeah, that's pretty amazing. Yeah, you can find rewards in your job. What made you choose working with autistic patients or
I think it chose me, honestly.
um,
It just seems like even when I was running my own business, every family that I took on that I cared for, I was either helping with an autistic child or someone with severe ADHD. I helped someone with Parkinson's and dementia before. So it just kind of seemed like the
Like it's your
specialty
calling.
like just coming to me. And then
Okay.
come to find out that my own daughter, she wasn't diagnosed until later in her teens. She was originally misdiagnosed as having Tourette's, but later on they figured out, well, she figured out she had autism.
Okay.
So, and they retested her and they said, yeah, she had autism, and what they had diagnosed as Tourette's was actually her stimming. So I also have a personal passion because of my daughter having autism. And when we were going through her diagnosis, my husband was sitting there going, check, check, check. And he realized he was a high functioning autistic that was never diagnosed because that just wasn't really a thing when he was a child.
Yeah.
So you were just hyperactive or you just didn't focus. And,
I think that happens to a lot of people. Like today, they're finding out, oh, I've had this whole time.
Yeah. So come to find out, my husband's high functioning autistic and my daughter is high functioning autistic. So I have that personal feel into it, as well as just it seems like they're drawn to me. Like, so why fight it?
Yeah, why fight it? It works for you and you seem to do really well at it. It's your calling. Very passionate about that. That's amazing. So I wanted to look back at your business when you start, like, before, because that's really interesting. A lot of people will work like at a corporate job for so many years and then decide, I'm gonna go off and work for myself. So you kind of are doing the other way around.
Yeah. Well,
Yeah.
it was kind of funny because I still self-publish books. That's how I've gotten up to 20 books, but it's not steady pay. So I get like little checks here and there. Some months are good, some months not so good. I'm not like a huge author, so it is what it is. It's fun. It helps keep my creative side going. So I
Right.
still have to feed that too. It's
Mhm.
important to feed your passion as well.
Yeah.
But when I decided to go back to nursing school, I didn't want to get into a job where they weren't going to work around my schedule. So I was like, well, I'm just going to work for myself. And however, I found like working for myself was great. I was making like $17 an hour by the end because I had built such a good reputation. But the thing was, I had no health benefits. I had no vacation pay. When the clients went out of town for their vacations, I was left with no money unless I talked them in to let me come in and organize or do extra cleaning while they were out of the house, which I had some of the clients actually did let me do that. But I was like, I would like to go take a 2-week vacation at some point and have money. So I decided I wanted to get into the corporate world. I wanted to be able to make more money, but I knew I wanted to get higher up. I didn't want to be the grunt worker anymore. I wanted to get into management at that point. Originally was nursing. And then I thought, well, I just might as well be a manager of healthcare. And then when it came time for the MBA, I was with COVID happening and healthcare being kind of, I just decided instead of going for my master's in healthcare administration, I would do an MBA because it still works with healthcare for management. But it also gave me the option if I ever wanted to leave healthcare and I wanted to go to a factory or just like a big corporation and try to move up to like an executive level, I could have that with an MBA. Whereas if I did my like master's in healthcare, I'd be pretty much stuck in healthcare.
That's
So
true.
I had to kind of weigh my options, and I wanted to be able to have more options. Healthcare seems to be attracted to me, and that might be where I stay, but I like to be able to have my options.
That's important, having your options open, right? When you had your home health care, and I know you were working with a lot of patients and whatnot, and some, like as you were saying, like maybe you were just doing some, work in the house for them or things like that, kind of assisting them with their daily functioning. did you have to get any kind of certifications or anything like that to make that work? Or
No,
how did you
because I
even?
was doing all direct care pay. So the families were paying me money directly, not running through healthcare.
Okay.
So no health insurance. So when you're not doing health insurance, the families can pay you.
Oh,
I
so
wasn't,
families just pay you cash. You don't have to like try. So you weren't trying to get maybe work with Medicaid patients or anything like that. Okay.
no. So it was all direct care pay. That's how you get around all those loopholes for that. I mean, the family trains you on what they want you to do, and then you just do it how they tell you to do it.
Okay.
One of the consumers had a nurse that would come in once a week and do things for her. And actually, that nurse was the one that talked me into going back to college originally. And she said, "You're doing all the stuff we do. You're just not getting paid what we get paid." She's like,
Okay.
"Go back and be a nurse." So she's actually like kind of helped put me into that mind, like, well, yeah, I am doing all the work you do, but I'm not getting paid as good as you.
You should get paid.
Yeah.
Yeah. So okay. Oh, that's really good. Okay, I'm really interested in the books.
Okay.
Also, can you tell me about like just since I'm so interested in the books, I mean, are any of those in healthcare? What genres have you been writing?
No.
How do you think
So
it
I
published?
have two children's books that I've written under my Carrie Lee Williams name. The rest of the books are under my pen name called Lee Savage, and they range from poetry to horror to paranormal, erotica, horror erotica, uh, so adult fairy tales. So kind of a wide range of fantasy
Hmm.
fiction.
So you have fun
Yes,
sometimes. You give this is your fun time when you start writing.
yes.
And all that. How do you publish?
So I do what's called publishing on demand.
Uh-huh.
And I just do it directly through Amazon now because they bought Create
Okay.
Space. So I created, and then I originally had an editor that I would hire. And then my husband took over that part of reading over my stuff to try to check for everything. Because
Mhm.
when I was a year out of work, we were publishing a book every month.
What?
So, and that's how I did the Seven Deadly Sins, and I put out basically it was like it would go a month and then the next one would come out and then the next one. And we just kept doing
Seven Deadly Sins, what a series that you wrote, or
it.
okay.
Yeah. So it's Seven Deadly Sins, and then there's a bonus story that's only out in a anthology collection right now. When the rights come back to me, I'll release it as an individual story that's called Lucifer's Mate that kind of sums it up. But that I did in 2019 when I was like looking for work.
That is so interesting. Where did your inspiration come from for these?
So they come from all over. Sometimes it's from dreams, sometimes it's from something that someone said, or if I've read a book and I was like, well, what if it happened this way?
Oh,
Um, Sometimes, like with the anthologies, they'll give us a theme and they'll say, okay, you need to write so like I wrote a story called Red that was in an anthology. And the concept for that was like you have to take a grim fairy tale and make it dark. And so I did a Little Red Riding Hood called Red as a dark horror erotica.
okay.
Um,
That's really cool.
yeah,
Wow.
with the anthologies, you're usually with anywhere from 5, 10, 15 different authors, and you all submit like a story into the collection of the book. And they have different runs. So I think these books had like a 6-month run. Once the 6 months over, the story comes back, and I have full rights to it to re-release it.
Wow. That's pretty amazing. Yeah. That's so interesting. Wow. So you just do everything. It's really
Yeah.
cool. That's
And I will give a tip for people that do stuff like that, because I also have done acting and modeling too. Most of my workers don't ever know what my pen name is. I have a whole separate LinkedIn profile and everything for my pen name. Most of them never know my secret identity.
That's something you don't want people to know, or are you cool with people knowing?
I'm cool with people knowing. And actually, it did come up in my director's meeting because one of them was so curious and wanted to know what books because they're an avid reader. So I did admit it. And I'm just like, don't hold it against me. You know, if I tell you who I am, you cannot hold it against me. It's just a lot of times if people find that out first, they're going to think of that being me. And I want them to think as
Carrie
the
the
professional me.
administrator, not Carrie the writer.
Yes.
Right.
Because I actually have a whole different persona for Lee Savage when I do events.
Okay.
Yeah.
Where can people find your books if they're interested?
They are on Amazon.
All right.
And there's a few of them on Smashwords. And I also have a website that has links to all my books on different places they can find them, like PayHip. It is leesavagemedia.com.
All right. That's pretty great. Thank you so much. Carrie, it's been really great talking to you, but I have one question left, if you don't mind. Could you possibly give what advice would you give to young undergrads who are studying healthcare administration and trying to get into the business or into the industry, and they may be graduating soon, or maybe they just graduated this year and they're a bit lost?
Yeah, I would say get started early. Don't wait until you graduate to get started. Look for networking events so you can meet people in time. Bring resumes to those events. A lot of times they'll have a table where you can lay resumes out. Make sure you handshake, talk to people, introduce them, make a good impression, but try to get in somewhere as an entry level. Because a lot of those places I interviewed for, they didn't care really if I managed. They would have if I had been a receptionist in a doctor's office, they would have took more time with me. But they were like, you haven't worked in an official healthcare setting. Private duty is not the same. So get into that doctor's office, get into a place like Judavine Center for Autism, Easter Seal, someplace like that. Start at the entry level, like DSP or the receptionist, and work your way up. That way, when you actually graduate, you have healthcare stuff on your resume that's official with the company, even if it's only part-time. I wish they would have told me that I really needed that in order to be taken serious, because people just were like, well, it's nice you ran your own business. It's nice you published books. You have not managed people. You have not actually been in a healthcare setting. So, and they were like, you don't know the programs we use. I'm like, I'll learn it. They don't want to teach. So get in there early, start networking early. No one even told me there was networking events for healthcare administration until my senior year. And I'm like, why would the first semester, I should have been already enrolling into these, paying to go because it's cheaper as a student anyhow for most of these organizations. Go to their luncheons, passing out my resume, handshaking. So that way, when it came time for me to graduate, guess what? I've already made good impressions, and hopefully if a job comes open, they're going to be like, hey, this might work for you. And what you don't know is that person might know someone else who comes to them and says, do you know anyone that can do this? And if you've made a good enough impression, that person will go, oh, wait, I do know someone here, and pass you along.
Absolutely. That's so helpful. I agree wholeheartedly with everything you just now said, because I think that's my experience. So, quite similar. And I feel like it's probably happened to so many other people who are just getting started in healthcare. So thank you for that. If anyone needs to contact you, asking any questions, where can they do that?
They can reach out to me on my LinkedIn, and I'm sure you can provide a link to that, and they can private message me, and I'd be happy to get back with them. They could take a look at my profile, and I have lots of networking people. It's a great tool to start building up your networking. That's how I found the guy that redid my resume for me. You make those connections, you never know what you can come across. So, I mean,
I agree.
So build up your LinkedIn profile too. And a lot of the people that I have on there for my LinkedIn profile, they're open to connection. So feel free to look through and see which ones are open to connect and send out invites and start building up your LinkedIn profile as well. And if you have any questions, send me a message.
Wonderful. Thank you so much. I agree wholeheartedly. Thank you for this interview and for giving us all your information and everything. It's been a pleasure. And I will go ahead and let you go.
Great. Thank you so much. Have a great day.
You too.
Bye.